We're starting things off with this new coronavirus variant and how the Biden administration is handling it. They are kicking things into high gear. The U.S. has joined a growing number of countries that have now confirmed cases of the Omicron variant. Now, the first U.S. case was detected in California, and someone who recently traveled to South Africa, that person is said to be improving after experiencing just mild symptoms. South Africa's COVID-19 cases, meanwhile, appear to be surging at the fastest rate since the pandemic began. Omicron is now the dominant variant in some provinces there. That's prompting the U.S. to take additional steps to protect Americans in the winter months ahead. So later today, President Biden is going to be introducing some new measures. They will include updated requirements for people traveling to the U.S., expanded free at-home testing, and a push for boosters for all U.S. adults. He'll make the announcement while visiting the National Institutes of Health later on today. But for more on the government's action plan, let's bring in Nancy Cordes, who is at the White House. So, Nancy, we spoke earlier, and you kind of laid out a list of what we can expect, because there are a number of additional measures that are going to be implemented, some of them immediately, some of them in the coming months.
Right. It's sort of a kitchen sink approach, Anne-Marie, because no one, not the scientists, not the White House, not the federal government, no one knows exactly how virulent this new Omicron variant is. They don't know how transmissible it is, and they don't know how responsive it is to the vaccines that we currently have. And so what you're going to hear from the president later today is a whole host of new policies aimed at addressing all of those problems when we don't quite know yet how severe those problems are going to be. So as you pointed out, yes, he is going to announce that the booster will be more widely available. There will be more pharmacies providing it, more appointments available at those pharmacies. There are going to be new family vaccination clinics, mobile clinics that'll be set up to get the whole family vaccinated. They're going to aim to make testing cheaper. Testing is something that has been surprisingly expensive in this country. At-home test kits can sometimes run $30, $35 for one test, and that's now going to be 100% covered by private insurance. And then, of course, there's going to be these new airline requirements. Anybody who's traveling to the U.S. from overseas, they used to, up until now, they've had to get a negative test within 72 hours of their flight. That is now going to shrink to just 24 hours. So you're going to have to get tested and get the results within 24 hours of getting on that plane.
Mm-hmm. Yeah, you know, that testing, making sure that it's cheaper, getting insurance to cover it, can really be a game changer. I, for the first time, had to go out and pick up a couple of tests after being invited to a friend's house, but they wanted to make sure that everyone was safe, so they asked that we get tested. And I have a small family. It's just a family of three, but you're right. It's, you know, 23, 24, 25 bucks or so. So that's 50 bucks just for one, you know, outing. That's not going to be easy for a lot of families. So Dr. Celine Gounder served on then President-elect Biden's COVID-19 advisory board. And she actually spoke about these new measures on CBS Mornings earlier, saying that it's a step in the right direction, but perhaps a bit late. Here's what she had to say.
I do think we need to be tightening up our recommendations and restrictions around travel. I think we should have really tightened up that window for testing far earlier in the pandemic with the emergence of the Delta variant, which has a very short incubation period. So I think it's a move in the right direction. It's a little bit too late.
You know, I've heard people say this before, that we should have learned these lessons already, but do White House officials feel the same? Is the U.S. behind in its response to this new variant?
I think these travel rules, they've been evolving over time. They change month to month and seem to move in the direction of becoming more restrictive. But also, there's an attempt to balance efficacy with logistical concerns. I mean, the fact is that there are many places around the world where it can be very difficult to get a test and get results within 24 hours of getting on a plane, particularly if you're getting on that plane on the weekend or on a Monday. There are some countries where it can be very difficult difficult to get tested on a weekend. And so the rules up until now have sought to balance the obvious reality that the sooner you get tested before you fly, the more likely that test is to catch a COVID infection and prevent you from getting on that plane. And now what you're seeing is a move based on the unpredictability of this new variant to say, you know what, it might be more logistically challenging now to get to the U.S., but at least we'll have a better handle on who has COVID before they get on a plane to come to this country.
Right. So in regards to this new variant, does the administration anticipate any additional help for states where the Omicron variant has popped up? You know, we saw with sort of our last series of surges that, you know, New York, though nothing has been detected in New York, but New York was a major hotspot. California was a major hotspot, and we have a case in California. Additional resources may be needed in some of these states as this new variant starts to pop up over and over again. Will they be able to get what they need?
Yes, the White House says that they're going to be boosting the number of surge teams. This is a concept that we've seen deployed before. Doctors, nurses, technicians going to parts of the country where they're seeing a huge spike in cases, where hospitals are full, where there are more people who want or need to get vaccinated or tested and the like. So they say there are going to be dozens more of these teams that can be deployed to parts of the country that are seeing big spikes in the number of cases. We're also going to be seeing in high population areas an extension of the mask mandate on mass transit. So not just on airplanes, but on trains, on buses, on subway systems, light rail. You're going to have to keep those masks on through mid-March at the very least. Originally, those rules were set to sunset in January. Now they're going to go ahead and extend that as well.
I know I asked you this question already, but of course we're learning more and more about the spread of this new variant. It was first reported in South Africa, but now we know that in the Netherlands it has been identified. It was identified even earlier. They've done some testing and they realized it was probably in the Netherlands in October. Right. Any possibility of this travel ban being broadened?
You know, that's possible. We're already seeing changes to travel restrictions this week. There were changes last week. I think it would not be surprising if we saw more changes as we learn more information, whether that means specifically an increase in the number of countries where people will not be allowed to travel to the U.S., to and from the U.S., that remains to be seen. But I don't think we've seen the last of new restrictions when it comes to travel. We also haven't, seen all the science yet. And so we're still waiting to see, for instance, whether scientists will determine that something like an Omicron specific booster would be a good idea for the vaccine makers to develop. And we will only know that once we know how responsive the variant is to our current crop of vaccines. And so that's something that Dr. Anthony Fauci was already talking about yesterday, saying that the administration is in talks with vaccine makers to discuss whether that would be needed and how long it would take to get it. But he made sure to point out that nobody should be waiting and not getting boosted now because they think, well, maybe in a few months there'll be an Omicron-related booster. He said the safest thing right now is to go ahead and get boosted if you are eligible.
Yep, get yourself boosted. Nancy, thank you very much.
You're welcome.